This is my client, Paul, who flew from New Jersey to Hesch Institute in Aurora, Colorado, with a diagnosis of left cuboid syndrome. And he'll tell us how long he's had the problem, what he thinks caused it, and his efforts of getting treatment, and what we accomplished in one visit here.
Yeah, so it's been a minimum of 3 years, possibly as long as 5, that I've been in pretty much continual pain. Just from getting on and off a forklift every day. I'm in construction work, and my job is on and off a forklift all day onto a hard concrete surface. So I would notice the pain, would increase as the day went on. And I had started with a podiatrist and then went with chiropractors to try to figure out what was wrong. I had MRIs done because initially thought there might have been a break in the bone because the pain was that intense. And everything came back from x-rays to MRIs, no breaks, nothing wrong, but yet still had the pain and some swelling. So in just a short 1-hour visit, Dr. Jerry was able to mobilize the area, and even just standing, I can immediately feel relief. I'm standing and the pain is gone. So it's really amazing. This smile is because that pain is gone. So,
now, we found that you were stuck in multiple joints.
right.
So we had to mobilize the subtalar joint, the midfoot, the fibula, but we did not even mobilize the cuboid itself, because in response to restoring motion in those other joints, then the cuboid mobility was naturally restored.
Right.
We also treated your hip because you had tightness in your hip rotators.
Right.
And the body always compensates. And because you were supinated in your left foot, then your left leg was a little bit longer.
Yep.
Until we straightened it out. And in response to that, your upper cervical vertebrae, the atlas, C1, rotated to the right slightly. And in response to freeing up the foot and ankle, the upper cervical released.
Right.
And maybe that'll cut down on your headaches,
Yeah.
on tension headaches.
And I would even go to the chiropractor knowing that my atlas was off and specifically ask, can you adjust this? And that's a very tough joint, at least on me, to get to release. And sometimes it would work and sometimes it wouldn't.
Yeah.
But whenever it did work, it made a huge difference. I could even feel it in through my shoulder.
Interesting.
That my mobility in my right shoulder would be better.
Interesting.
So, yeah, that's amazing.
Yeah, and it's hard to fight a reflex. I mean, your nervous system reflexively was making it rotate right because of the foot and ankle and hip.
Right.
So the best way to mobilize it, in my opinion, is to mobilize the foot and ankle and the hip.
Yep, the foundation.
So I'd like to see you once more for a brief visit. We also had added wedges to your feet, medial wedges, because your heels don't evert. And that felt helpful, right?
Yep, absolutely.
And maybe that will help prevent recurrence as well. And do you feel like you know what to do to maintain this?
Yeah, yep.
Yeah, so it's going to be a total of 2 visits for cuboid syndrome. And based on your response today, I'm extremely optimistic.
Amen.
So thank you. Anything final?
I just wish I had found you sooner. Thank God for the internet and YouTube, because that's how we connected. And it's just awesome that you can reach out that far across the country and make that connection so quickly nowadays.
Yeah, we're so blessed to have that. Thanks.
Yeah,
thank you very much.
Thank you.